Hello, my name is Junsheng. I'm a physicist from Atlantic Health System in Morristown, New Jersey. U is for ultrasound. An ultrasound scanner works by sending high-frequency sound waves from a probe into a patient's body and measuring reflections of those waves from tissue boundaries. When sound waves encounter a tissue boundary, such as the surface of an organ, some waves reflect, meaning they bounce back from the boundary. Such a boundary is called acoustic interface. The densities of the tissue on each side of the interface determines the amount of reflected energy. The scanner calculates the distance from the probe to the acoustic interfaces based on the time it takes for echoes to bounce back to the probe. The distance and the intensities of the reflected sound waves are then displayed on a screen to form a two-dimensional or 2D image. Ultrasound imaging does not use ionizing radiation, so it is used to do many things. It is used to investigate causes of pain, swelling, and infections in the body's internal organs, to examine fetuses during pregnancy, and to examine the brain in infants, among many other things.
My name is Lisa Genovese, and I'm with Kruger-Gilbert Health Physics. V is for volumetric modulated arc therapy. Volumetric modulated arc therapy, or VMAT, is a radiotherapy technique that involves rotating the linear accelerator around the patient in arcs while also using multi-leaf collimator motion to shape the treatment beam and paint the radiation dose over the target while sparing surrounding normal tissue. The treatment time for VMAT can be very short compared to other techniques. The use of arcs spreads out the entrance around the patient, reducing the overall dose to any one particular area except the target that is overlapped. This can minimize exposure of normal tissues to the treatment field.
My name is Leonard Kim, and I'm at the MD Anderson Cancer Center in Camden, New Jersey. W is for workload. The workload is a concept used by physicists who are calculating and designing radiation shielding barriers around a room where there is radiation present. Many times, physicists describe workload in terms of radiation dose per week. Different types of treatments, even if they result in the same dose to a target, can have very different workload associated with them depending on how they are delivered. Physicists take this into account when they're doing their shielding calculations. As a center becomes busier over time and is imaging or treating more patients per week with radiation than when calculations were initially completed, their workload will increase. Physicists are responsible that the shielding in place is adequate to keep members of the public, staff, and patients safe.
Hi, my name is Karen Brown. I'm at Penn State College of Medicine. X is for X-ray. X-rays are a type of electromagnetic radiation. Basically, they are a higher energy form of light. X-rays are able to penetrate most ordinary materials. However, the larger or denser an object is, the more it will absorb X-rays. We can get information about what is inside an object by generating an image from the X-rays that pass completely through it. X-ray machines are imaging devices used to reveal the internal structure of patients. They make use of the fact that X-rays can penetrate a patient, and that this behavior varies in degree with the makeup of the patient's body.
Hello, my name's Ashley Cetnar, and I work at The Ohio State University. Y is for yttrium-90. Yttrium-90 is a radioactive isotope of the element yttrium. Some interesting facts are that yttrium-90 is generated by the decay of strontium-90, and its half-life, or the time for about half of the starting atoms to spontaneously decay, is about 2.5 days. For practical use, yttrium-90 can be used in tiny radioactive beads called microspheres. When the microspheres are injected into the patient, they collect in the tumor blood vessels so that the tumor can be targeted with radiation.
Hi, my name is Jackie Esthappan Zoberi. I am a medical physicist at the Washington University in St. Louis. Z is for atomic number. The atomic number of an element is the number of protons in its nucleus. Scientists use the shorthand Z for atomic number. Each element has a unique number of protons in its nucleus. Different versions or isotopes of an element can have the same number of protons but different numbers of neutrons. For example, there are 33 different versions of the element radium. Each of these isotopes has exactly 88 protons, but they all have a different number of neutrons. The atomic number of a material makes a large difference in how radiation interacts with it, which is why almost all subfields of medical physics care about the atomic number of materials they are studying or using.